Good evening. Welcome to Left, Right and Centre. Breaking news coming in. The group of 20, the G20 nations, are going to inject $5 trillion into the global economy to deal with the coronavirus outbreak. We'll bring you an update on that in just a few minutes. But on the show tonight, 602 individuals have now tested positive for the coronavirus in India. 13 are dead. What's clear is that the virus is horrifically infectious, as one case study in Delhi shows. A woman who returned from Saudi Arabia has infected 8 individuals, including a doctor at a Mohalla clinic and his family. And now, as a result, 900 individuals who visited the clinic are being observed for symptoms. This on a day when the government announced a 1.75 lakh crore package meant to provide the poor food and put money directly into their bank accounts. This is why this is crucial. The video you see here is shocking mobile video from West Uttar Pradesh's Badaयूं. Let's roll those images where the police have made these young men with bags hop and crawl on the highway. They are migrant labor, we are told, looking to get home. With the shutdown, they have no jobs, no place to stay, and as they struggle to get home, they are beaten up by the police, who are under orders to maintain quarantine. The lockdown, as it were. Well, the big breaking news story coming in: with the global economy floundering at this stage, the group of 20 nations has agreed to inject $5 trillion into the global economy. My colleague Nidhi Razdan joins us. Nidhi, what are the details? All right, we'll come to Nidhi in just a few moments from now, but I've got a couple of these details with me. According to sources, Prime Minister Modi has spoken of the alarming costs of the pandemic. He was part of this call. He's called for a concrete action plan as well for the group of 20 nations. He's asked for the G20 nations to share medical research. He says the World Health Organization needs reforms. It's based on a last century model, is what the Prime Minister said of the WHO. Remember, the WHO is what we are relying on for global numbers. G20 leaders have said that the current restrictions have a finite timeline. There is no discussion on the origins of the virus and ascribing blame to China. Nidhi Razdan now with us. Nidhi, what are some of the major points, and how soon would we know when this money, trillions of dollars, enters the global economy?
Well, Vishnu, we're not clear about the timelines just yet, but what we do know is that G20 leaders held this extraordinary video conference today. It's the first time that G20 leaders have ever had a video conference meeting, and that too on a humanitarian issue. It is normally economic issues that they come together for. But on COVID, they decided to meet today and decided that they would inject about $5 trillion to help the world economy, the global economy, which is really in a crisis at the moment as a result of this pandemic. And there were a couple of other important things that they emphasized. Firstly, to help least developed countries, those countries with a poorer infrastructure, health infrastructure, to help them. They have agreed to jointly work in finding a vaccine to deal with the pandemic. Sources also telling us that the G20 leaders discussed the current restrictions and lockdowns in some detail, saying that, look, these are temporary in nature, though we can't give a timeline. They are definitely, finite. And we need to work towards finding a way to coming out of that. There was no discussion on the origins of the virus, how China handled it. In fact, officials telling us that instead the focus was on cooperation and finding a way to move forward. Now, the Prime Minister's interventions were therefore important. The Prime Minister asking the G20 to freely and openly share their medical research on COVID-19, saying also that the WHO needs reform. That it is based on a last century model. The Prime Minister particularly talking about the alarming, quote unquote, alarming social and economic costs of this pandemic. And therefore, the joint statement, Vishnu, that has finally been issued by the G20 basically looks at fighting this pandemic together, safeguarding the economy, ensuring that trade disruptions that are currently in place are taken care of, and to help least developed countries in order to fight this, Vishnu.
All right, Nidhi, thanks very much for sharing that update. Trillions of dollars will be put into the global economy. How soon? A big question, one way or the other. The global economy needs this. India certainly does. The Prime Minister making India's concerns abundantly clear. Well, our top story tonight, how 900 people in Delhi are under observation after a doctor at a Mohalla clinic got infected. We'll come to that story in a moment. This Mohalla clinic doctor was infected by a woman who returned from Saudi Arabia. Now, why is this our top story? The reason is because it gives you an idea of the extent to which this is an infectious disease. The fact that if you do come in contact with anybody, the chances of actually contracting this are very high. And therefore, these numbers are important, because if you look at the line graph going sharply up on Indian cases, it's because of the infectious, the contagious nature of COVID-19 that this is also frightening. March 20th, 223 cases, and just 6 days later today, we're at 694 confirmed cases. Remember, there are patients who are discharged, who are migrated, and then there are deaths. The reason why things in India are still hopeful, and I think the word to use is hopeful, is because that death rate, which now stands at about 16, is very low compared to what it is in many other countries which have entered thousands of deaths. That is where social isolation is so important. So that death rate has been kept in check so far. We only hope that that sharp spike that you see, March 20, 21st, 22nd, all the way to the 26th, doesn't keep going, because the larger the number of cases, the greater the number of deaths are actually going to be the case. Now, the WHO has also said that, look, it's great that countries like India are in an isolation period, a period when there's a lockdown. This lockdown in India is the largest in human history. 1.3 billion people are meant to be in this lockdown. But this is a time when there is a lot of work to be done. Lockdowns, he said, are not enough. This time must be used to attack the virus. In other words, to test, to trace, and to treat. Well, here is why testing is clear and is so important, and why what the WHO chief says is critical. Close to 1,000 people have been quarantined in Delhi after a doctor of a mohalla or community clinic tested positive for coronavirus. Now, the chain of infection has started with a woman who returned from Saudi Arabia on the 10th of March. She visited the clinic with symptoms of COVID-19. She ended up infecting 8 people, but because there were hundreds of individuals who went into that clinic, nearly 900 people have now been put under observation, under quarantine.
This is the Mohalla clinic in northeast Delhi's Mojpur, where a doctor has tested positive for coronavirus along with his wife and daughter. Now the government has quarantined for 14 days the 900 people who visited the clinic between 12th and 18th March. But there are many others who are still worried.
मेरे बच्चे ने दवाई ली थी यहाँ से और उससे अब बहुत फीवर है, बहुत तगड़ा।
कब ली थी आपने?
18 तारीख को ली थी सर। एम्बुलेंस को फोन कर रहा हूँ सर, इसी के लिए जाने के लिए हूँ।
एक शिकायत है, यहाँ बिहार के मारू बिलोनवा गली में कोई दवाई छिड़कने वाले नहीं आ रहा है, गली में का नाम कोई नहीं आ रहा, ना सफाई वाला आ रहा है, और गली में ना कोई सैनिटाइज किया गया किसी को। अब पूरा डर है, अब देखो घर से निकल सकते, मैं दुकान करता हूँ, दुकान पे नहीं बैठ सकते।
But what needs to be understood is the chain of infection that led to the doctor testing positive. One corona-positive woman infected 8 others, including the Mohalla clinic doctor. On 10th March, a 38-year-old woman, a resident of Delhi's Dilshad Garden, returned from Saudi Arabia. On 12th March, she developed fever and cough and consulted the Mohalla clinic doctor. On 17th March, the woman tested positive. On 17th March, the Mohalla clinic doctor developed fever and cough and was sent to GTB hospital. On 20th March, brother and mother of the woman tested positive. On 21st March, 2 daughters of the woman tested positive. On 22nd March, the Mohalla clinic doctor tested positive. On 25th March, the wife and daughter of the doctor also tested positive. On 25th March, a relative of the woman's brother who picked her up from the Delhi airport on her return on 10th March tested positive. On 25th March, the government issued directions that all those who visited the Mohalla clinic in Mojpur between March 12 to 18 should home quarantine themselves for 15 days. Right now, nearly 1,000 people are under quarantine, including 74 contacts of the woman and 900 of the doctor.
14 दिन के लिए उनको कहा गया है कि घर से बिल्कुल बाहर ना निकलें। तो लोग अगर घरों में रहेंगे, एक दूसरे से नहीं मिलेंगे, तो ये चेन टूट जाएगी।
After this incident, the Delhi government has ordered that it will test all its healthcare staff who is involved in treatment of corona patients. All the staff that is involved in collecting samples of patients shall also be tested for corona. Samples of all patients with severe acute respiratory illness admitted in government hospitals will also be sent. Samples of all these people will be sent for testing within 24 hours to NCDC or the National Center for Disease Control. The samples will be taken from all Delhi government hospitals as well as central government hospitals like AIIMS and Safdarjung. On the other hand, in Mohalla clinics and other places, queues of patients have increased since hospitals have closed their OPDs.
हर चीज का जवाब हर इंसान के पास रहेगा ही और वो पूरा सही ढंग से बोल पाएगा, ये मानना थोड़ा सा कठिन होता है। आप अगर पेशेंट्स के साथ अगर डील करें तो आपको पता चलेगा। उसको अगर आप पूछे कि क्या आपने परसों खाने में कुछ गड़बड़ किया था, कुछ हाँ बोलेंगे, कुछ ना बोलेंगे। जो आप अंदाज बांध रहे हैं कि कम्युनिटी में ट्रांसमिशन शुरू हो गया होगा, वो शायद उसके लिए इतना एविडेंस ठोस नहीं है अभी भी। और अगर रहता था तो हम क्यों नहीं बोलते थे, क्योंकि हमको छुपाना कोई सही चीज ही नहीं है।
This case is a typical example of how quickly coronavirus spreads. One woman's infection has now led to 8 others being infected and nearly 1,000 people being put on home quarantine. The Delhi government's decision to expand testing to healthcare workers as well as patients of respiratory distress could prove to be a good move in detecting more number of cases. In New Delhi with Sharat Sharma and Akshay Dongre, this is Sukirti Dwivedi for NDTV.
So think about it. One individual has ended up infecting at least 8 others, right? They've tested positive already for COVID, but more than 900 people have been kept in quarantine under observation. This is how dangerous COVID-19 actually is if you come in close proximity to somebody who has the infection. Joining us now, the Aam Aadmi Party MLA Raghav Chadha. We're also joined by Dr. Ashok Seth, Chairman of the Fortis Escorts Heart Institute, and also Dr. Rajat Jain joining us from Mumbai, who's the President of Doctors for You. Dr. Jain, thank you also very much for being with us. Let me go across to Raghav first. Raghav, the 900 plus individuals who are under observation now, do any of them have symptoms of COVID-19?
Vishnu, if you could kindly repeat your question.
Can you hear me now, Raghav?
And get the echo directed. Yes, I can now.
And we'll fix the echo as well. I apologize for that. Do any of the 900 plus individuals who are under observation now, are any of them showing symptoms of COVID-19?
Well, I got off the phone with the Health Minister of the Government of Delhi some 15 minutes ago, Vishnu, before getting onto this show. And no such thing was certainly mentioned by him. And I am given to understand that all those people who came in contact either with that patient or with the doctor have been home quarantined. And barring the family members of the doctor and family members of the lady who had come from Saudi Arabia, no other person has yet been tested positive. Of course, if the symptoms do arise and tests are conducted, we will get to know in the coming days. But yes, it does show that this disease, COVID-19, is certainly contagious and the community transmission is for real. If community transmission does start, it will start and grow at a rapid pace. And in the kind of setup that we live in, the community transmission can be stopped only and only by the community itself. No government, no agency of the state can stop community transmission. And therefore, it is the responsibility of the community and community alone, I would say, Vishnu, to stop and ensure that community transmission does not begin. But yes, of course, this is a case that does, sort of highlight how contagious this is and how quick the community transmission is. And, I have for a very long time, after, spending a lot of days in my constituency, ever since this outbreak has happened, I have noticed that there are two kind of sort of feelings that people are undergoing. One is of panic and the other is of denial. Half of them are in panic and the other half are in denial. I think there is a space between being, panicking and being in denial, and that is the space of preparedness where I think all of us need to be in. That is the space that we need to capture, and I hope that with the kind of coverage that you and your channel are doing, more and more people are aware of how contagious and how community transmission is rapidly growing, and appropriate precautions are undertaken, because as precaution is not better than cure in this case. Precaution is perhaps the only cure as far as COVID-19 is concerned.
Just one small contention to what you're mentioning is that, generally when they use the words community transmission, in other words, the next stage of the infection, it's when they don't know the original carrier of the infection. In this case, you've done a fantastic job in actually locating the original carrier, and then so you know where it's come from. But Dr. Seth, isn't this...
well, may I?
Yeah, go ahead.
You're right.
Yes,
yes. In this case, yes. In this case, we have done contact tracing, but we were able to do contact tracing simply because we maintain a logbook, a register at every mohalla clinic, and therefore every patient that concerned doctor, that infected doctor had post the Saudi Arabian woman was meticulously jotted down, and the names and addresses of those people were available. But the larger point that I'm trying to make here is that in most cases, such sort of logbook or the mechanism of contact tracing may not be available.
No, it won't.
So therefore, all of us
critical.
need to be extremely.
And the person maintaining that logbook, Raghav, I mean, that person has done an incredible job. The person diligently maintaining the names of everybody, that individual could actually have ended up saving a lot of lives. Dr. Seth, my question to you is
this. And not just the patients, Vishnu.
Sure.
Not merely the patients that doctor interacted with post the interaction with the Saudi Arabian woman, even those attendants who came along with the patient to consult that very same doctor have been home quarantined.
Right. Dr. Seth, isn't this precisely the reason why we need to test a lot more? Because you've got 900 plus people in a home quarantine situation now. Raghav says that at the moment none of them have symptoms, but shouldn't there be a proactive way in which we can actually start testing some of them even if they don't have symptoms right now, because the number is huge and we know how infectious this disease is?
That's right. So there are two aspects to this. Firstly, Vishnu. Firstly, of course, here are contacts of a person who's already tested COVID positive. And of course, therefore, these actually do fall in that situation of having tests. This is a different situation. This is a stage 2 situation. When we talk about testing, and believe you me, India is too vast to continue testing everyone who complains of a sneeze or a fever. Till now, what we've seen is that we've been able to trace back, and the government has done a tremendous job each time of knowing the source, tracing the contacts meticulously, documenting them, and either quarantining them or testing them. Now, this is a huge aspect. But I think the next phase is a worrying phase, that if there are people like this who actually do not reveal their travels, who do not reveal their contacts and are out there in the community, then we would actually have what we call the stage 3 of the disease, which is the greater worry, which we are praying that doesn't happen to this country. And the impact of that would be vicious, enormous, and perhaps the saddest thing which we would ever seen. So when we are coming to that, this is the great time to have this lockout. This is the right time to have stopped everybody from moving out. This is the right time for us to take the responsibility, just like Raghav Chadda said, for the public to take the responsibility along with the government. But what the government has to do in this time that it's bought itself for two to 3 weeks is testing, is creating the infrastructure, because this 3 weeks is not going to demolish the disease. It's still going to be there. It's going to resurge the moment we actually stop this self-isolations, this curfew status that we've actually got. And then when it rears its head up, it's again going to be vicious. So this is the time we hope that we can put our infrastructure, our tests into position, we trace the contacts, we go after the disease, and we actually try and control the disease.
Sure.
Otherwise, we would have lost the time.
Dr. Rajat Jain, President of Doctors for You. Doctors for You is doing tremendous work, it needs to be mentioned at this stage, voluntarily going out over there, trying to counsel people, trying to help people who fall unwell, looking at various symptoms and if necessary, recommending them for these tests. Dr. Jain, you would have heard perhaps what the WHO chief said earlier today. He said that lockdown is great, but it's not enough. That to fight the virus, you need to test and you need to treat. Is that where we need to do a lot more of? Because it's no longer about how many testing kits you have. We might have the capacity. If you're not actually testing, then how are you fighting the infection?
Coming to this, like we are repeatedly saying on this, that what WHO has said is absolutely, I agree on that mere social distancing is not gonna just help. We need to isolate and we need to treat. and we have to do. But if you look at this whole scenario, we are repeatedly advocating that this disaster is different from the other disasters because the health care is at risk. Now, if you look at this Delhi scenario, what has happened is that Saudi Arabian woman has infected the doctor, and then the other people got infected, and that doctor has, the 900 people have consulted that particular doctor, and now those people are at risk. As we know, this coronavirus is highly infective, so protecting those doctors becomes the primary key over here, and that will help us in reducing the transmission. Now, as we know that just mere social distancing is not gonna help us in every way, but it will definitely decrease the burden on the health care, predominantly because if the health care will be crippled at this point of time, what people are not understanding is that it is not just the corona, it is the many other diseases that will kill the people over there. There are many other diseases that are there now which are being taken care by the healthcare workers. Now, if the healthcare workers are not being protected at this point of time, the entire system will be crippled, as what we are seeing, what is happening in the other countries like Italy, where people are short of everything in spite of having such a robust system.
Right. Raghav, just
so providing...
Vishnu, I just need to come in for a bit.
Yeah, Dr. Seth, go ahead.
Come in for a bit and say that it is high time that we realize that
your voice is breaking.
The doctors need to be tested because one healthcare worker being infected at this stage takes away numerous other healthcare workers. And if other healthcare workers go away, it takes away a lot of the healthcare systems which are needed. Every person in the healthcare is needed at the moment to provide service to numerous other patients who may actually have this disease process. So I think it's very paramount that we maintain our healthcare systems, protect them, and continue to test them thoroughly and protect them from this disease process.
Right. Raghav, let me just come back to you for a moment. The worry is, even, depending on what rates you look at, rates of transmission, 900 people in quarantine could end up infecting as many, hypothetically speaking, as 2,700 people. Now, that's the worst case scenario, obviously, that no one expects that to take place. But my question is this: how are you going to constantly monitor these 900 people who are in home quarantine at this stage? Are there agencies to ensure that they actually maintain that quarantine, that they don't step out? Because if these individuals have come in direct contact with that doctor or even the woman who went to get treated, then they are in an extremely vulnerable situation.
Well, yes, Vishnu, a few basic checks are in place to ensure that those who are home quarantined do not step out of the premises of their houses. One, of course, is that a big plate is pasted outside their houses saying that this particular family has been home quarantined, and there is a big signage put outside the house so that people don't visit that house, and if at all any person from that house does happen to, in an emergency, step out of the premises of the house, appropriate social distance is maintained. Apart from that, the local law enforcement agency, along with the civil administration, that is the DMs and the SDMs and the ADM, have been instructed to ensure that those who are home quarantined do comply with the instructions of the government and do not step out of the premises. But at the end of the day, of course, I mean, if the number grows and it's in thousands and God forbid in lakhs, then of course even the capacity of the civil administration as well as that of the law enforcement agency, which is the Delhi police, is limited. And therefore, it's not just monitoring those who are home quarantined, even providing appropriate health care, from testing facilities to beds to ventilators. All these things are limited, and the capacity of not just my government, any government in the country is limited. And therefore, if it actually grows and reaches the levels as it has reached in various other countries, we don't have the requisite healthcare infrastructure in the country, no matter in which state you're in, to cater to the kind of community transmission that we're talking about. And therefore, the precaution is the only solution to this. This is a war-like situation, and it is a war which no agency of the state alone can fight. The army, the law enforcement agencies, the might of the civil administration cannot fight. It is for the people and the governments to come together and fight this. It can and only be fight when people come together. People do comply, and happy to report that today people did comply with the lockdown instructions and they complied with the restrictions.
So
we
was it
have
better
not
today in
heard
Delhi
of
than yesterday?
many violations.
Was it better today?
Yes, and that's
by what percentage?
Yes,
I mean, can
yes,
you tell us?
yes, much.
Ballpark. Was it 10% better?
Well,
or,
I don't.
I mean,
I don't have the figures, Vishnu, to quantify as
but
to
it's
how
better. It's
it
better
was.
today.
But it's much better. People are complying with it. And even those few instances of police's high-handedness that were reported yesterday, that for example an ordinary doodh wala who was cycling down the path to supply milk was beaten down brutally, so on and so forth. All that has been stopped. Of course, the government has come up with an e-pass system where you can generate e-passes.
Okay, Raghav, I'm interrupting you now because I think what you're talking about is something. It's critical, absolutely, and if you hold on for a moment, I'll try and give you an opportunity to do that.
But may I just on community
but Raghav,
transmission
can I just
rotate
Vishnu, the strike a little bit?
There is no need to panic. I'll just take 15 more seconds. There is no need to panic because up till now only 36 COVID-19 have been reported in Delhi, out of which 26 patients were people who had flown in from a country where the levels of COVID-19 are high, and the remaining 10 are the ones who have contracted this disease due to community.
No, and what you're talking about is exactly what I wanted to focus on as well. That there is hope, and there is hope as far as recovery is concerned, and that's what brings me actually to my next guest. And I'd request Dr. Rajat Jain to just remain with us, and the two of you as well, because in all of this, we don't want to scare people. We just want to bring them the facts as they are, because there is hope, and the hope is that a large number, in fact, the largest number of people who contract the infection do get better. They become all right. We are now joined by one such individual. I'm not naming him at this stage. He survived the coronavirus. He and his wife went on their honeymoon earlier on in the year. They visited 2 countries in Europe. They came back. They did test positive for the coronavirus. He is all right now. His wife still under treatment. Thank you, sir, very much for being with us. Just for the benefit of our viewers, how bad were the symptoms? And can you describe to us some of the symptoms of COVID-19 that you felt?
Yeah, sure. So when I got it in the first few days, it was mild fever. First day it was mild fever with a little headache. Next day I had high fever with sore throat. So the fever was around 102.5 degrees. And that's when I felt that I might go for screening. I went for screening, and next day I was taken to isolation. So then that was my third day. I got lot of cough. I developed lot of cough, and then there were body aches at random parts and headaches. But with medication, the symptoms were handled well. And once the medication started, so I did not feel that much. But before that, it was slightly bad. But after that, it was all right.
Is your wife getting better at this stage?
Yeah, so her reports came today, and she is also negative now.
Oh, that's fantastic.
Yeah.
That's absolutely fantastic. And could you tell us a little bit about the healthcare professionals who were treating you?
Yeah. So so I was there in Bangalore facility, and the healthcare professionals were quite helpful and caring, and obviously they had to take the precautions as there. So we largely communicated over the phone unless it was very necessary. For the cleaning and for serving food, the doctor came and asked me for the symptoms. But otherwise, if any other thing they wanted to ask me, they would generally do it over phone.
Right.
But yeah, the cleaning was done every day, and they served food all the times, multiple times, 5-6 times.
Well, I'm glad you're feeling better now, you and your wife, who is also now corona negative, and you can get back to your normal life. You will be discharged very, very soon if you've not already been discharged. Thanks very much. Indeed, I just wanted to go back to Dr. Rajat Jain for a moment. Dr. Jain, this is a critical point, that most people will get better. That doesn't mean we take it easy, but the fact of the matter is this: if you're younger, then chances are that you'll be fine, it won't become worse. Is that also not a message which people need to take in to build up that sense of hope, because it's not all hopeless.
Yeah, I agree with you that most of the people get better. Now, if you see that more than 80 to 85% of the people develop a mild disease. But now, because of the high infectivity rate, what is happening is, like, if you look at the severe disease, it happens in 10% of the population, and on those 10%, like 5% may require an extensive support. But the kind of rampant infection that has been seen nowadays, even that 5% in country like India will be a very, very big number.
Okay.
I definitely agree that that gives a hope that more than 80% of the people will develop a mild disease.
Right.
But considering the overall infectivity, the total number of patient is going to be increased a lot.
Dr. Jain, thanks very much for speaking to us, and thank you for being there for patients and others who need doctors, people like you, professionals. Thanks very much.